Okay, this discussion is going to look at laser and light therapy. So we're going to talk about the difference between the two. Essentially, you're using light source per se for both of them. The difference is just going to be kind of how it's concentrated. So we're going to talk about these two different types of therapies. Important to note that when it comes to lasers, there's so many variations in units and things like that. I always talk about in modalities class, how like for instance with STEM, it's important to get to know your unit. I would say that that even applies even more so with lasers, because of the different classes of lasers and the different wavelengths and stuff like that that they kind of emit. So we're going to talk about again just how this gets applied and kind of how laser energy gets used in rehabilitation. So looking at laser, so laser is a mnemonic for light amplification of stimulated emission of radiation. Lasers should not raise treated tissues above 36.5 degrees. That's why they're called low-level lasers when they do that. Now, some of the newer ones that are coming out do provide a little bit of a heating sensation that ones in the past haven't. We'll kind of talk about that a little bit and what the significance of that is. So basically what we're looking to do is utilize wavelengths of laser light, because what they do is they cause specific physiologic changes in the body. So we've kind of determined that these very kind of intense non-divergent beams of light can be used to create different types of cellular effects in the body that can kind of enhance the rehabilitation process. Now, light therapy, light therapy kind of includes a couple different forms. So you have light emitting electrodes, superluminous diodes, UV light. So these types of light, they have different characteristics as far as the light that gets generated. And both lasers and light therapy are lights, okay? It's just the differences as far as the divergence of the beam and what that means as far as the treatment. But again, much like what you get with a laser, the light that you get from the light therapy modalities kind of has, they believe, have a similar effect on the specific tissues. Now, when an interesting thing about lasers is one time, so they're really only approved for specific conditions. So right now, they're only really approved for chronic neck and shoulder pain, IT band syndrome, carpal tunnel, and for research. Any other use is considered an off-label application. Now, that doesn't necessarily mean you can't use it on other injuries, other parts of the body. It just means that it's going to be considered off-label. So there's certainly application to other forms of treatment. This list, the list of approved conditions may have expanded. I haven't seen anything specific on it recently, but obviously individuals do use it off-label. Is there a certain degree of liability with that? I would say yes, but however, for the most part, as long as you're being responsible with your treatment, you're likely not going to cause any damage to the individual. So laser production. So basically what's essentially going to happen when a laser gets produced, so basically you get photon emission, okay? Basically when energy gets applied to an atom, it gets excited. When the atom returns to a ground state, energy gets released as a photon, okay? And ideally what we look to get with laser is that photon generation leads to increased amount of light energy, okay? So photon emission photons are basically little packets of energy. And what basically, again, has to happen, we get movement of electrons in an atom to a higher, then back to a lower place. And then what happens is that photon releases spontaneously some energy. And again, what essentially is going to happen is that when you look at your laser, in the lasing chamber, you get your amplification, and that's what's going to be what allows for the light energy to be produced. So basically what you're getting is this movement of electrons, and then photons getting produced, and then the energy getting released, okay? And again, inside the lasing chamber, you're going to have your energy source, your lasing medium, and when energy gets applied to the lasing medium, that's when the atoms are going to get excited, and you're going to get that electron movement. And that's going to happen inside the lasing chamber, or essentially the laser unit that you're actually using. So the components, You have your medium, which is going to be inside the laser. It's either going to be a gas, a solid, a liquid, or a semiconductor. You have your power supply, which is going to supply the energy, and inside you're going to have what's called a resonating cavity, which is a little mirrored chamber. And what basically is going to happen is this is how the energy is going to get produced. So on the next slide, there's a picture kind of showing how all these elements kind of interact. But essentially, you have your medium, which is going to be responsible for the photon discharge. That's going to create your energy. The laser is going to get emitted through a partially reflected end. So on one end of the mirrored chamber, it's what's called a half silvered mirror, and that's going to be where the actual laser gets released from the lasing chamber. So a little bit of science here as it relates to it, but you'll see on the next slide when you see the visual as far as kind of how this is made up, it'll kind of all make sense. So here we have, if we look at laser production, so this is just kind of a picture kind of showing how this works, okay? So we have that photon energy that we talked about. Here's the electron in the ground state. It goes to an excited state, and then it comes back. The photon gets released, okay? And then if you look down in here, you have that lasing chamber, okay? So here's your lasing chamber. Here's the total reflected mirror. Here's the partially reflected one. So basically that energy kind of bounces around and essentially gets released on the semi-permeable mirror side, or the half-silvered mirror, if you will. That laser beam gets released, okay? And again, the energy and everything is going to be dictated based upon whatever the lasing medium is. So inside this laser, you're going to essentially have a medium, whether it, again, gas, solid, whatever it might be. That's what's going to be producing that laser energy that eventually does come out of the actual handheld unit that you're utilizing. So we look at the properties of laser light. So this is kind of what we're getting into when we're looking at this. This kind of gets the difference between what's really the difference between a laser and what's just considered light therapy. Essentially, again, they are both using lights. It's just the different qualities of the light that you're utilizing. So you have monochromaticity, okay? That means that the light is a single frequency, single color, okay? So for instance, when you look at a light bulb, okay, in a room, there's actually multiple colors coming out of that. We don't perceive it, but there actually is. When you're talking laser light, it's monochromatic. It's all one color and it's all one frequency. Coherence means that they're the same length and are traveling in a similar phase relationship, okay? So when you're looking at this picture here, okay, as it relates to coherence, so A would be a light bulb, okay? A would be representative of what the light looks like from a light bulb, okay? B would be an LED light, okay? So you notice it's starting to come a little bit better. C would be a laser light. So B would be an LED light like you would have with, again, the light therapy as we talked about. C would be they're all traveling in the same phase relationship. Okay, so same length, same phase relationship would be what you would be looking at. Collimation refers to the degree to which the beam remains parallel with a distance. Okay, so when you take a laser and you, for instance, if you just took a laser pointer and pointed at a wall, laser pointer is laser light, pointed at a wall, that light remains parallel at a distance. It doesn't change. Okay, whereas light from these other sources doesn't remain collimated. It doesn't remain parallel like you'd be doing. Your classifications of laser light, and again, not all of these necessarily relate to therapeutic laser. So classifications are 1, 2, 3A, 3B, and 4. Most forms of therapeutic lasers are what are classified as 3B. Okay, so 3B lasers are typically what therapeutic lasers get considered. So with laser parameter selection, we're going to look at two different perspectives here. We'll look at patient parameters. You want to look at your medical history and diagnosis. Make sure that the laser is an appropriate treatment for what it is you're doing. Make sure it matches your goals. Look at the stage of injury the individual is at, because the laser will have a different effect based upon what stage of injury, in other words, what part of the healing process is involved. Any medications, okay, particularly something like antibiotics. So antibiotics do make patients a little more photosensitive. The skin becomes a little more sensitive to light. So that would be an important consideration to look at. Pigmentation. Individuals with darker skin tend to absorb more light, so that could possibly impact some of your treatment parameters. Your laser parameters, we'll talk about how all these influence the treatment. So you have your wavelength, your output power, the average power, the intensity, and your dosage. Okay. Essentially, the lower the frequency and the longer the wavelength, you're going to get increased depth. So just like you would see with a lot of other treatment parameters, if you lower the frequency, your depth is going to increase more. Power also influences depth, so how much power is actually getting output through the laser will also influence how deep the laser goes. So in looking at different types of lasers, again, one of the things you want to consider is the wavelength and the frequency of the laser. So wavelength, ease of application, intensity. So, and the only reason why I'm throwing in wavelength and frequency together is the lower the frequency, the longer the wavelength, and vice versa. The higher the frequency, the shorter the wavelength. The lower the frequency and the longer the wavelength, you impact deeper structures. Another thing to note is the actual power of the laser will also influence depth of penetration. And again, these are usually things inherent to the laser. They're not necessarily parameters that you would select. We'll talk about kind of how you go about selecting parameters later on. As far as different types of lasers, and we'll talk about typically what they're pretty good for. Helium neon lasers tend to be very good for wound care. That should be wound care. There, it's a little sloppy, but gets the point across. Indium, gallium, aluminum phosphide, that's considered a semiconductor material. That's good for wound care as well. Then you have your gallium arsenide. That's a semiconductor and gives a little bit deeper penetration, so you can treat some deeper tissue with that. Same thing with gallium, aluminum arsenide. You get deeper tissue with that. And like a lot of other things, as time has gone on, we've kind of come up with new technology. There's also combination probes. So this is why I say there's so much variation. Like the laser that we have at school is a very specific type of laser, and we'll go through that laser and kind of how it gets utilized and why. But you have to kind of look at, so when you're buying, it's very important to think about what you're going to be using the laser for, how versatile you want it to be, because that's going to influence how you'll then utilize it. Now, LEDs and SLDs. So again, these are forms of light therapy, okay? So you're essentially using the same type of energy. There's just a slight difference as far as what's different between lasers and LED. So just to kind of note what they are. So an LED, which is also a semiconductor, LED emits light when electricity is kind of passing through it. So you basically have a substance that produces light energy once electricity is passing through. An SLD just utilizes what's called a PN junction. Okay, so it's basically for an SLD uses two pieces of semiconductor materials made up of different substances. Again, you pass electrode through the diode, and the diode gives off energy, and that's where you basically create your SLD energy from. So an important thing to note with, and this is one of the biggest differences, and it kind of dictates how LEDs and SLDs are different from laser, because again, they're all technically considered light. They're monochromatic, but they're not coherent, okay? So in other words, you're not getting coherence, which if you remember when we talked about coherence, that's when all the waves are the same length and they're traveling in the same phase relationship. That's not happening with these forms of modalities, okay? But they are monochromatic. The other thing that you typically have with this is that the treatments have to be longer, because the energy, given the fact that you don't have that coherence and you don't have kind of that concentrated beam, treatments tend to be larger or tend to be longer. You still get essentially the same effects, but you have to usually have a longer treatment. The other thing too is they tend not to penetrate as deep as a laser will as well. Okay, so they take longer to deliver the same amount of energy. Again, other differences, they tend not to penetrate as deep. With the laser, the emission from the diode is processed to stimulate additional photons as well. We don't really know if coherence is necessarily effective for clinical effectiveness. So, in other words, what I'm saying is, say you have something like this down here would be an example of like a light therapy pad. Is this as effective, or is it less or more effective than an actual laser? We don't really know, because we don't know if coherence is absolutely necessary. So you're essentially getting the same effects, just kind of with the caveats that I discussed as far as how the actual energy is getting used by the body. So the effectiveness of light therapy on tissues. So when we're kind of looking at this, is going to kind of talk about what actually happens. So basically, when you apply light therapy to tissues, you get this excitation of electron bonds within a molecule, and the idea there is to get an oscillation in relation to these. So we're basically getting a movement of these atoms that's going to create energy. And the idea is that we get these rotational changes of atoms in a molecule, and the end result of that, what we're looking to have, is increased levels of ATP. So what's going to happen is nitric oxide is going to get released, and that allows oxygen to bind to receptors, and therefore then the mitochondria, which is kind of the powerhouse of the cell, creates energy, can help synthesize ATP. So ATP is our most immediate source of energy. So that nitric oxide release is going to encourage that. And it's also believed that what this does is it creates lower levels of reactive oxygen species. So we talked about free radicals when we were discussing inflammation and some of the issues associated with free radical production. So molecules such as that, and even like hydrogen peroxide and oxygen ions, they tend to, if you lower the levels of those, particularly in the case of injury, that will increase levels of ATP. And again, ATP, as you'll see, is going to be important. Again, I talked about it as being our immediate source of energy. There's healing implications to having increased levels of ATP, or what we call adenosine triphosphate, in the body. And that's essentially the cellular effect of what's going to go on when we apply light therapy to tissues. So in regards to tissue healing, the reason why increased adenosine triphosphate is so important, because you increase fibroblast production. And the idea there is that's going to increase the strength of the wound, or obviously the damaged portion of the tissue. So now what's going to be important is understanding through the different phases of tissue healing, there's going to be significantly different effects. So during the cellular phase, we're kind of looking at, as far as like a lot of what goes on during inflammation, you're going to get increased mast cell release and interleukin-6 formation. So interleukin-6 is just an inflammatory regulatory substance. It kind of keeps the for lack of a better way of putting it, it kind of keeps the inflammatory phase moving along as it should. So we're basically kind of encouraging that process during the inflammatory phase. So we're taking those positive effects, and we're trying to basically enhance them, because we need that inflammation to create healing. During the collagenization phase, when we're starting to actually lay down collagen, you get enhanced collagen formation and increased myofibroblast conversion. So what a myofibroblast is, so myo refers to muscle anytime you see that. So a myofibroblast is a fibroblast that kind of starts to create that contraction of the wound, which will eventually happen, we want to have during the remodeling phase. So the more myofibroblast conversion you have during the collagenization phase, the faster you'll get to the remodeling phase. And then during the remodeling phase, further application will continue wound contraction and also increase the specific tensile strength of the tissue that's trying to heal. Now, the other thing that laser therapy is very good for is for pain relief. Some of the reasons why we get increased pain relief is believed through laser therapy is through an increase in serotonin levels. So serotonin, if you remember from our pain control, our different levels of pain control, it's one of the substances that gets released that inhibits pain transmission. Decreased cholinergic release is another thing that also reduces the transmission of pain. Inhibition of prostacyclin, which is an inflammatory marker, which during the inflammatory phase it increases pain production. It increases sensory nerve transmission time. So remember, if you're increasing sensory nerve transmission time, that means essentially you're slowing it down. So the idea is if the sensory nerves are taking pain information back to the central nervous system, if you slow that down, you're going to have increased pain relief. Increased CNS pain perception threshold, and they also believe that placebo could be at play too, which again isn't necessarily a bad thing, but there is possibly a placebo effect. So we think that at some level the laser light therapy has, some or possibly all of these effects on being able to reduce pain. So when we look at the actual treatment, so again, some of this stuff, there's going to be a lot of things we go through. However, you're going to be kind of limited as far as what you actually change. So again, it kind of comes back to that theory is what is it that you specifically manipulate about the treatment, okay? So while there's a lot of parameters, you don't necessarily change them. So in other words, power output, you'll see that's going to be in watts or milliwatts. That is not adjusted by the clinician. That's going to be a specific output based upon the laser that you're utilizing. Power density is the intensity, the average power per unit in square centimeters, and this is determined by the beam diameter. So, watts per centimeter squared. So very similar to what you see in with ultrasound here, except again, it's not adjusted quite the same way ultrasound is. But it's just basically looking at the average power output per area. The average power is going to be based upon whether you're using continuous or pulsed mode. So lasers kind of have both continuous or pulsed mode. The average power is going to be, you're going to look at that as joules per centimeter squared is going to be the unit there that you're looking at. And then the treatment duration. So one of the things when you're looking at continuous versus pulse, obviously if you're using pulsed, you're going to have to do a longer treatment to get the same effect. So again, you look at your options to kind of determine how it is that you actually want to apply that. And really, in most instances, when you're looking at lasers, the only way to alter the dose, the only way you alter the dose is by treatment duration. So with all of your injuries, you're going to have a certain dosage or a certain number of joules that you're going to want to apply to the area. However, in most instances, the only way to alter that, you're not going to be able to change power or power density or anything like that. You're just basically going to be changing the treatment time for this in most instances. So again, you want to look at the energy dosage when you're doing this, and we're going to talk about the treatment techniques that you can utilize. All right. So the energy applied per unit area, which is measured in joules. So joules are kind of the treatment dosage that you're looking at with this. And one of the techniques that individuals use, we'll talk about the different techniques, but the grid technique, which I think is probably the easiest one to kind of control the dosage. What you essentially do is you just you kind of break up the area into a grid. There's a picture of it on the upcoming slide where you actually break up the area and you just essentially hold the laser over each area for a certain amount of time, and then you based upon what your overall dosage is, you'll kind of apply based on the time to each individual spot on the grid, if you will. The treatment time is going to be influenced by 3 factors. It's going to be influenced by the area of the treatment. It's going to be influenced by the average power output and the dosage you want to achieve. Okay? As we said, the power output of a laser is fixed. The only thing you can really alter is time. And the idea is you're looking at your dosage. So your dosage is based upon, your dosage itself is based upon 3 things. And that's based on the average power, output power, time of light exposure, and the treatment area. So see how all of these things kind of interact when you're, kind of determining that. But that's what you want to look at. So what you'll do is you'll look at the dosage for the for the type of injury you're dealing with, I'm going to give you some dosage ranges that you can use based upon whether you're dealing with an acute or more chronic injury and how that gets utilized. Depth, remember, we said is based on two factors. Depth is based on wavelength and power. Okay, so both of those can influence the actual depth of the laser. Your dosage range. So this is what I'm looking at right now as far as, in some textbooks give some different specifics for certain injuries. I'm going to look at it from this perspective. So if you have an acute wound that's open and you're treating it, you're going between 0.5 and 1.0 joules per centimeter squared. You could increase that slightly if it's chronic. If you're dealing with intact skin, you're going to be somewhere in the range of 2 to 4 joules per centimeter squared. So, and again, really for the most part, the only difference is that you're going to be doing a longer treatment time. So again, a lot of these things I'm talking about, like wavelength and stuff like that, that's all inherent to the unit and the type of laser you're using. Really, the only thing that you're going to change is the treatment time. Okay? So again, that's why I say when if you go out to buy a laser, you have to kind of educate yourself on what you're going to be using it for and what your options are going to be. As far as pulsing mode is concerned, more research is kind of needed. Really, right now, all we really know the difference between pulsing and not pulsing is that pulsing just is going to require a longer treatment time. So there's a little more research needs to be done on if there's any specific benefit or why you would use pulse treatments. Treatment frequency, you want to do moderate doses about 3 to 4 times per week, and you don't want to do more than 1 treatment daily. So when we're looking at application, okay, so there's a couple different ways to do it. There's point application. So point application is really going to be based upon how big your treatment area is. So if you have a very small area, you can just do point application. You just put the laser on the area. Typically you get about 1 centimeter squared with that, and you're just going to basically put firm contact on the area as close to the skin as possible. Okay. If you have an open wound, they recommend being about 1 to 2 millimeters away, so not necessarily putting it right on top of the open wound. But that's where you would do your point application. Scanning, you would basically move you'd basically move the laser head similar to what you would do with ultrasound. Again, you're probably going to keep the treatment area for that still pretty small. A better technique to use if you're treating a bigger area, it's a little more precise, is the grid technique. So you see here, but with the grid technique, so you have a larger area. So what they do is they break it up into these little small 1 centimeter squares, and what you basically do is you apply your laser to each area for the appropriate treatment time, and then by the time you're done, you have an entire area treated. Okay, you don't have to worry. It's not like ultrasound where you have to worry about heat dissipation and stuff like that, because that's not what you're trying to get out of it. But if you want to treat a much larger area, the grid technique is a little bit more precise. Now, it's important to note the depth of most laser treatments is only about 5 millimeters, okay? And again, that's going to be dependent upon the wavelength and power of the unit. So again, that's why it's important to know, is the wavelength long enough to get, at least that deep, if maybe not deeper, if you plan on treating, again, intact skin and some of your deeper soft tissue injuries, okay? With point application, it's important to, actually with all the applications, it's important to take into consider the cosine law, making sure that you're perpendicular to the body part region, and the inverse square law is also important. You want to have it as close to the area as possible. There's also, again, there's cluster probes. So cluster probes tend to utilize different forms of laser energy. You see here a picture of one. This is much different than the type of applicator that we'll use in class, but that's what's called a cluster probe. Sometimes they actually also use a combination of laser and LED lights. Again, that just is dependent upon the actual unit that you're utilizing. So our effects and indications of laser therapy, again, actually before I get into this, again, just the whole idea behind using lasers and lights is to promote normal cellular function. Again, it's important that you don't apply too much energy, so particularly with wounds, you don't want to be too aggressive. Even with chronic wounds, even though we said to increase the dosage slightly for chronic wounds, you still don't want to be too aggressive with it. So some things you're looking to do, you want to actually reduce certain inflammatory markers. So reduction of prostaglandins and cyclooxygenase 2 can inhibit some of the negative effects of the inflammation that we tend to experience. Decrease pain. Again, there's a lot of different proposed mechanisms. We talked about some of them, the increase in serotonin, things of that nature. All of those things we know can possibly decrease pain through that. Promote tissue healing. So again, the basic premise behind tissue healing is the cells absorb the energy and we create adenosine triphosphate. So the adenosine triphosphate allows the energy production to be able to produce increased fibroblasts and get some of those positive effects as far as healing is concerned. That also increases the strength of the scar tissue, particularly during the remodeling phase. Muscle function actually has been found to be enhanced with low-level laser as well. So if you think about, again, if we're increasing adenosine triphosphate, that can be very important as far as muscular performance, fatigue, and recovery. So there's some benefit as far as improved muscle function in general just by the application of low-level laser therapy. And again, you could use this with other modalities. So other modalities in addition that could be beneficial to laser treatments. So blood tends to absorb laser energy very good. So any modality that increases blood flow, if you're going to use it, you have to be mindful of that. So while some modalities can be good and enhance it, other modalities may actually limit the effectiveness. So if you're using it with other modalities, make sure you're using it with a modality that's going to enhance it, not harm the treatment. So it's generally recommended that tissues be cooled before laser treatment and heated afterwards. So if you're going to use heat, make sure you use it after laser, because the idea is that if you heat, you increase blood flow. The hemoglobin is going to absorb the energy, so therefore it's going to make your depth of penetration less. If you're going to use ice, you can use it before, because that's going to decrease blood flow to that area. So it's important to kind of note that. The other thing is also consider medications may have an effect on laser efficacy. So non-steroidal anti-inflammatory drugs, steroids, and calcium channel blockers are thought to block membrane channels and pigment receptors, which are important for laser action. So those types of medications, we already talked about antibiotics, can all do that. So, you know, it's important to kind of note that if your patient is on certain types of medications, that may influence the laser energy. Safety considerations. So a big safety consideration with lasers, eye safety. So many lasers come with protective goggles that get utilized to protect the eyes, because obviously if the laser light gets into the eye, it could cause significant damage to the retina. Cell proliferation. So a lot of this has to do with the amount of laser energy that gets given, so the dosages. So there's actually a decrease in mitotic activity with very high doses of laser energy, but a proliferation with low. So the low doses that we're looking to utilize are done for the perspective of to help with cell proliferation. So if we apply too much, you could end up having an actual decrease in mitotic cell activity, okay? But you get a proliferation with low. So you want to make sure that you don't exceed doses. Adult dose should not exceed 50 joules. Children under 14, it should not exceed 25 joules. There is potential fatigue reaction. So fatigue has been reported after laser treatment. Usually this was short term and was more common with chronic pain conditions. So we're not quite sure of the connection there, but that's important to note. The pain response. Again, some people will actually complain of pain after treatment, and some of this could be due to the fact of the activation of the normal healing response. Okay, so in other words, the healing mechanism that maybe was dormant or wasn't as optimized prior to that. So this is actually considered a positive response sign. So if someone does have pain after treatment, that could actually be a positive, especially for chronic injuries, because it's showing that the healing process is actually starting to take place. Again, other issues that come about, again, the skin color, skin tone. Again, darker skin tones do tend to absorb more light energy, so that could be a factor in your application of laser. And obesity, because of the depth of penetration being very low, if there's high levels of adipose tissue, the treatment might not be effective. Contraindications, so obviously the eye, we know that light laser can be very damaging to the eye. So if the patient or therapist are using a laser 3B or higher, so if you're using a 3B or a class 4 laser, which they make for therapeutic purposes now, they should be wearing protective goggles. Anyone in the vicinity should be wearing protective goggles. Pregnancy, just because there's kind of limited studies on it, and that's what you're going to see with a lot of these contraindications. So many times, as far as contraindications are concerned, and I think I mentioned this before, sometimes it's not that we know necessarily that something negative is going to happen. We just don't know. And again, the benefits of the therapy don't necessarily outweigh the risks. So we'd rather kind of err on the side of caution. So there's no published research showing that there's any issues with unborn children, but as a precautionary measure, especially with certain areas of the body, and particularly over the abdomen, you would avoid that in a pregnant patient. For cancer, again, there hasn't been any mutagenic effects reported with this. Cancerous cells, though, have been stimulated to grow with laser. However, certain studies have actually resulted in a reduction of tumor size that was due to an enhanced immunological system. So the bottom line here is, again, from a rehabilitation standpoint, unless you have clearance from the oncologist to utilize it, I would not use the laser on the individual. Corticosteroid use, again, there's interactions between steroid use and laser treatment. So cortisol antagonists have found to inhibit the receptors responsible for the inflammatory effects of a laser treatment. So basically, it would very much limit the benefit of utilizing a laser. Over the thyroid gland, so you could potentially modify thyroid gland activity, which again you wouldn't want to use. So you definitely want to avoid treating over that region. And as far as children go, so again, no studies show any impacts on growth plates, but there's limited studies, so it shouldn't be done unless benefits clearly outweigh the risk. Generally, you want the recommended maximum dosage for children to be less than 25 joules, so you'd want to keep the energy level delivered to them pretty low. And these are your learning outcomes. So again, the bottom line is when you're looking at lasers, again, from the standpoint of parameters, I just want you to know those different kind of ranges for treating acute open wounds, chronic wounds, and then intact skin. Again, kind of know what influences your depth of penetration, what influences your treatment time, because really in the end, treatment time is going to be the thing that you're able to modify in most instances, because all of the other parameters are going to be set. Make sure you understand the different techniques that get utilized and how they get used, and again, just your general physiologic effects of laser light.